1Q. What characterizes left hemispheric stroke symptoms? A. Language/speech deficits, aphasia, right visual field deficits, cautious behavior. 2Q. What characterizes right hemispheric stroke symptoms? A. Impulsive behavior, poor judgment, left visual field neglect. 3Q. What neurological changes occur contralateral to the injury? A. Motor weakness, sensory deficits, visual field deficits. 4Q. What neurological changes occur ipsilateral to the injury? A. Cranial nerve deficits, pupil changes, eye movement deficits. 5Q. What is the prognosis difference between viral and bacterial meningitis? A. Viral, usually full recovery, bacterial, high mortality if not treated promptly. 6Q. What does a positive Brudzinski sign indicate? A. Meningeal irritation, neck flexion causes hip/knee flexion. 7Q. What does a positive Koenig sign indicate? A. Meningeal irritation, pain with leg extension while hip is flexed. 8Q. What is a key risk of untreated bacterial meningitis? A. Increased intracranial pressure leading to brain herniation. 9Q. What CSF findings indicate bacterial meningitis? A. High protein, low glucose, high WBCs, cloudy appearance. 10Q. What CSF findings indicate viral meningitis? A. Slightly elevated protein, normal glucose, clear fluid. 11Q. What is the priority intervention for meningococcal meningitis? A. Droplet isolation and antibiotics immediately. 12Q. What is the Glasgow Coma Scale used for? A. Assessing level of consciousness based on eye, verbal, and motor responses. 13Q. What is Cushing's triad? A. Bradycardia, widened pulse pressure, irregular respirations. 14Q. What does Cushing's triad indicate? A. Increased intracranial pressure. 15Q. What is the main risk of skull fractures involving the basilar region? A. CSF leakage and meningitis. 16Q. What indicates CSF leakage from the nose or ears? A. Halo sign or positive glucose test. 17Q. What type of hematoma is associated with a lucid interval? A. Epidural hematoma. 18Q. What type of hematoma is associated with slower onset symptoms? A. Subdural hematoma. 19Q. What is decorticate posturing? A. Flexion of arms toward the core, indicates damage above the brainstem. 20Q. What is decerebrate posturing? A. Extension of arms, indicates brainstem damage. 21Q. What is the priority for a patient with altered mental status and suspected stroke? A. Immediate CT scan without contrast. 22Q. What is the time window for TPA administration in ischemic stroke? A. Within 3 to 4.5 hours of symptom onset. 23Q. What is contraindication to TPA? A. Active bleeding, recent surgery, uncontrolled hypertension. 24Q. What is the main intervention for hemorrhagic stroke? A. Blood pressure control and surgical management if needed. 25Q. What does FAST stand for in stroke recognition? A. Face drooping, arm weakness, speech difficulty, time to call EMS. 26Q. What is a priority nursing intervention after TPA? A. Frequent neuro checks and monitoring for signs of bleeding. 27Q. What indicates brain herniation? A. Fixed and dilated pupils, abnormal posturing, decreased LOC. 28Q. What is status epilepticus? A. Seizure lasting 5 minutes or recurrent seizures without recovery. 29Q. What is first-line treatment for status epilepticus? A. Benzodiazepines, lorazepam. 30Q. What precautions are needed for a seizure-prone patient? A. Padded side rails, suction available, oxygen ready. 31Q. What is the postictal phase? A. Period after a seizure with confusion, fatigue, and amnesia. 32Q. What is the hallmark sign of myasthenia gravis? A. Progressive muscle weakness that improves with rest. 33Q. What is the tensilin test used for? A. Differentiating myasthenic crisis from cholinergic crisis. 34Q. What is Guillain-Barré syndrome? A. Autoimmune demyelination causing ascending paralysis. 35Q. What is the biggest risk with Guillain-Barré? A. Respiratory failure. 36Q. What is multiple sclerosis? A. Demyelinating autoimmune CNS disorder with remissions and relapses. 37Q. What is a common early sign of multiple sclerosis? A. Vision changes such as diplopia or blurred vision. 38Q. What is Parkinson's disease characterized by? A. Tremor, rigidity, bradykinesia, postural instability. 39Q. What causes Parkinson's symptoms? A. Loss of dopamine in the substantia nigra. 40Q. What medication treats Parkinson's motor symptoms? A. Levodopa/carbidopa. 41Q. What is ALS? A. Progressive motor neuron degeneration leading to muscle weakness. 42Q. What function is preserved in ALS? A. Cognitive ability and sensory function. 43Q. What is the hallmark symptom of Huntington's disease? A. Chorea, involuntary jerking movements. 44Q. What genetic pattern does Huntington's follow? A. Autosomal dominant inheritance. 45Q. What is a major complication of spinal cord injury above T6? A. Autonomic dysreflexia. 46Q. What triggers autonomic dysreflexia? A. Bladder distension, bowel impaction, tight clothing. 47Q. What is the first action in autonomic dysreflexia? A. Sit the patient upright to lower BP. 48Q. What is neurogenic shock? A. Loss of sympathetic tone causing hypotension and bradycardia. 49Q. What spinal cord level controls respiratory muscles? A. C3, C5 via the phrenic nerve. 50Q. What is the priority assessment in spinal cord injury? A. Airway and breathing support.